The advantages in seeing our physicians from the School of Medicine are that they're just as great and just as well trained as private physicians, but they also are involved in teaching and research. So we think that this is sort of the best of both, in which we have physicians who are very well trained, very current in their learning, they're teaching other physicians, but they also are practicing great medicine just like physicians in the private practice community. We're proud to have essentially all of the major specialties, many of the subspecialties in offices throughout the state. We have all primary care specialties. We have several of the surgical subspecialties, several medical subspecialties, pediatrics, psychiatry, child and adolescent psychiatry, a whole host of programs, essentially everything you would expect to see in a large multi-specialty clinic. I think the physicians who are on our faculty want to be with us because they want to be great physicians, they want to practice great medicine, but they also want to teach, and they want to conduct research, and they want to contribute to growing public medical education in the state. So it's sort of the best of both worlds. They get to practice, be great physicians, just like physicians in the community, but also do something extra for medical education. I think patients are sometimes concerned about how medical students and residents would be involved. We actually think it's a huge advantage. We think that this contributes to the quality of care. You have extra healthcare professionals who are interested in you as a patient. They spend more time with you. They're available in the hospital, perhaps more than the attending physician is sometimes. They're asking the physician hard questions, which always keeps us on our toes. So we actually think it contributes to quality. They're not intrusive. We think that they're very well supervised. They're not practicing medicine by themselves. You always have your physician available. We just think this is the way that education and clinical care come together to serve both purposes. Our faculty physicians are just like all private practice physicians. We see patients in the office, we have surgeons who are in the hospital operating, we have obstetricians and family doctors who are delivering babies. They follow their patients into the hospital. It's the full spectrum of care, just like any medical care would be, but again, with the involvement of students and residents, especially in the hospital, who will be there to see you sometimes when your attending physician is not available. We know that patients are sometimes concerned about being forced to participate in clinical research or being forced to be part of a clinical study. That is not at all true. We certainly encourage patients to participate because we think that may benefit their care and it may benefit the care of friends and family members and loved ones. And we also think that research trials sometimes will bring some new treatments to bear that could be beneficial to that patient, him or herself. But no, you're certainly not forced. There are always extensive processes to get your permission, and we explain the studies in great detail, and it's always up to you as to whether you participate. And if you do not participate, it does not at all compromise your care. But we are very encouraging because we think this is how medical care improves.